If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. This is our 17th season, and as you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. Now, it's more important than ever to become an informed patient, and we're here to bring you timely health discussions. For this episode, we have something really special. You're going to be glad you didn't go out tonight now. We have Dr. Anjalish Kumar, a urology attending at New York Methodist Hospital, and Dr. Gerard Lombardo, internal medicine and sleep medicine specialist at New York Methodist Hospital. And welcome, and we're going to get to talk to you in a little while. And of course, how remiss I would be without mentioning Kirsten Elizabeth, our new on-air assistant. How are you doing, Kirsten?
I'm great. I'm so glad to be here once again. How are you?
The week flew by. I don't know what happened.
So
Seems like I just saw you a couple of days ago.
It feels like it.
Yeah. What's anything with the highlight of your week?
You know, I just love fall so much, and I've been eating a lot of pumpkin.
You're getting ready for, yeah. Do you ever go out as trick-or-treating anymore, or that's done?
I do dress up, but I don't think people want to give me candy anymore.
Yeah, but don't be so sure. Okay, I want to thank you, Kirsten, and now for this episode, again, we're shaking things up. You know, we usually take phone calls. The phone's gone today. What we're doing is we're doing some housekeeping. Now, we have a lot of emails from all over the world. It's amazing what we get here that we have to answer. We've been remiss, so we're going to take care of that. And then we said, what more than have somebody who's talking about sleep? I mean, one of the biggest problems that the American public has is getting enough sleep, and you hear all these things, going to increase my risk of cancer, I'm going to be not able to drive properly, different things. And we're going to talk to Dr. Lombardo, who is a world-class expert in that. A book that I would suggest in advance. It's a great book. No pictures. I'm checking it out, so you got to read all the pages. It's about 400. Sleep to Save Your Life. So definitely, I recommend this. This is a great book, and it'll put you to sleep, so to speak. And of course, Dr. Kumar, who's been on the show before. Very rare to see a female urologist. Huh? Did the men get a little shy or no?
No, I mean, I think, people are just happy to see a doctor that they like, regardless of whether it's a male or a female.
I think so. It's good, and be happy to see you, any of the men out there. So it's great to have you. And you just had a baby.
I did, yeah. She's 6 months old now. She's a beautiful baby girl, healthy, happy baby, very pleasant.
I have something in the news you're going to be very interested in.
Maybe you could teach her how to sleep through the night.
Is that a big problem with newborns?
Sure, yeah, it can be for some. Some are blessed and go right through the night, but there are those with colic and things like that.
So we're going to get into that. We're going to get into that. But I don't even want to take too much time with this lightheartedness here. Let's get right to some important news items of the week. Number one, can you get rid of your tattoo? I read an interesting story, just came out yesterday, and the question is, what percentage of young people who get tattoos, when they get older, want to have it removed? Have any idea?
50.
Yeah, I would guess
50%.
I would guess
very
50.
good. Did you read the same article? That was very good.
I just think that when people get tattoos, it's a big deal to ink something on your body. So there's probably a pretty high degree of regret with something like that.
It is, and it turns out certain tattoos, like the yellow and blues, are harder to get out. And if you're a smoker, they're very hard to get the tattoos out. So if you plan to get it out, it's another good reason to give up smoking, right? So you got to watch those tattoos. Kirsten, you ever consider a tattoo?
Yes, I have considered. I might have one.
Whoa, can we see it?
It's right here. It says, Carpe diem, seize the day.
Very nice, very nice.
I don't regret it either. So I'm not one of those statistics.
Well, I think it's, some people get kind of large, grotesque, print someone's name on that they're no longer with and things like that.
Yeah, exactly.
Yeah. So, and then the other one is, now this is not so much for girls, but for infants and pacifiers, they don't do very well if they're boys. It seems that they have emotional stunting of their development. Or stunting of their emotional development, that might be better. And for boys in particular, and why? Apparently when you have pacifiers, you can't imitate emotional appearance of someone else's face. So you'd look to your mother, if she smiles, you see the smile. If you're not wearing a pacifier, not sucking on one, you would smile like that, or frown, or look sad, and it seems like the baby can't develop normally. So It's a reason not to let the baby boy play with the pacifier too much.
Interesting.
So yeah, one on the corollary though, SIDS is much lower in babies who are put to sleep with a pacifier. So there's always some, two sides to a story, but it sounds like moderation is the answer here. And then the other one, yogurt a day may be better than an apple to keep the doctor away. And there's something in the yogurt that lowers the blood pressure, the systolic blood pressure, and this helps you avoid heart attacks and so on. And they followed people for 30 years, and they didn't develop high blood pressure at the same rate if you had at least 3 yogurts a week. So yogurt's pretty good.
Yeah, I think yogurt's great. You have all the probiotics in it. It's good for gastrointestinal and vaginal pH. It's great for you.
It's good stuff. So it's something to consider. So stay on that yogurt. Now, we've already met the doctors. I will come back and meet them in between and talk a little bit more to them. But I want to, of course, mention Monsignor Bennett. You see Monsignor out there again?
Hi.
He's always on time, and it's a pleasure to have Monsignor.
He's great.
So let's take a short break, okay? We'll get everything set up. I see Dr. Lombardo. Look what he brought in here. We got all these devices to help you sleep better, and we're going to hear about it throughout the course of the show. This demo was given to Mr. Regis Philbin on his show?
It was similar, yeah. We had Regis
Almost as good as
through
this,
it.
similar, but not as good. So
Getting
anyway, let's take a little break, and when we come back, we'll be taking your calls, 718. Oh, we won't take the calls today, just seeing if you're listening. Take care. We'll see you in 30 seconds. And welcome back, where our topics are urology, internal medicine, and sleep medicine. And before we get to the demonstration, Kirsten, I think you have a shout out.
Yes, indeed, I do, Dr. Garner. Today we have a shout out that goes to Catherine Vaso. Catherine, thank you so much for watching. We appreciate it. Thank you.
Give her a hand. I like that. Good to see you out there, Catherine. And this is tricky to do a trivia quiz, but I just wanted to see amongst the three of you how you're doing this. Out of all the boys' names and girls' names, the two rows to the top, what was the most common boy's name for 2012 and the most common girl's name? I don't know.
Peter.
Is that your final answer?
Yeah.
No. But do you have one, Jerry?
I'm going to try Michael.
Michael used to be back in the old days.
Peyton.
Peyton used to be. Actually, I'll let the audience play at home, and this way, and we'll come back to that in about 30 minutes, okay? And also, I always like to have a religious quiz. What's the oldest Catholic church in the borough of Brooklyn? Another thing, just think about it at home, and we'll give the answer in about 30 minutes, okay? So now Jerry, Dr. Lombardo has brought in all this stuff and his sleep medicine stuff. Start us out. I'm really curious as to what we're looking at here.
Okay. Well, I think a good place to start is to think about how common sleep disorders are. There are 80 sleep disorders, and within those 80, we have 2 major categories, and some we're going to cover today. Disorders of excessive daytime sleepiness, so you're overtired and can't function during the day, and disorders of insomnia. So to get back to the excessive daytime sleepiness, we have obstructive sleep apnea syndrome, which is a condition we'll talk about in a minute. And we have sleep-disordered breathing in the form of simple snoring, and then a whole spectrum in between those two. So a very important message to get out there is to always mention to your doctor the key symptoms that you might have of obstructive sleep apnea syndrome, and the risk factors we'll talk about, and I'll demonstrate in a second.
So Jerry, what is that? Which one is that?
Well, what we're going to do is something very simple, is to measure neck size. So simply take a tape measure, such as this. Anything over 16.5 inches for the neck is a risk factor for sleep apnea, certainly in men and women.
I always size up like a half. I like a little comfort in there.
Yeah, we're talking about the exact size. So the size of the neck, when combined with things like hypertension, high blood pressure, obesity, being overweight, and actually men are at a higher risk than women. For sleep apnea, you want to make sure you talk to your doctor and go prepared to mention to your doctor you have symptoms, there is snoring, your spouse sees you choking or gasping during sleep with loud snoring and what looks like a resuscitative type gasp. And if you have these things, please mention to your doctor, and your doctor will be able to take it to the next step.
So 16.5 is the key for men?
16.5 for men and women. It's another half
Women
inch.
too?
It's a half inch less, but certainly, so 15.5 to 16 for women, 16.5 or more for men.
Interesting. Could you measure Dr.?
She's fine. I can
have a
see
small
from there.
It looks good. Okay. So that's very interesting. And I'm looking forward to seeing the rest of the stuff here.
Okay.
One of the things that we did for this show is Kirsten went out on the street and she started to talk to people about questions they might have for one of our two doctors tonight. How was that?
It was really fun. I went to Prospect Park, and I also went over to Queens to Astoria Park. And I quizzed some people to see how much they knew about certain
We
topics.
have a very smart audience, you found, right?
Yeah, very smart. And then they wanted to ask the doctors some questions too.
Well, let's see how smart they are. Let's roll the first video. What's this? You remember where this is from?
This was from Prospect Park,
From
and
Prospect
this
Park.
is Gary.
Okay, let's see what Gary has to say.
So I'm here with Gary. Gonna ask some quiz questions. Gary, what is prostate cancer?
That's something to do with the bladder.
It is a cancerous growth in the prostate.
Prostate cancer, I believe, is when your prostate gland is infected, or it has like a malfunction.
So first quiz question, what is prostate cancer?
Cancer of the prostate.
What did I tell you? Is that what do you think of those answers?
Those are answers.
So, but anyway, we have Dr. Kumar to tell us what is cancer of the prostate. What is prostate cancer?
Sure. Well, just to elaborate on some of the answers that our friends in Prospect Park gave us, the prostate is a gland which sits in between the bladder and the urethra, and it is indeed when cancer arises from that gland. It can, it can be asymptomatic actually. You don't usually feel it. It's usually detected sometimes by a blood test and sometimes by a rectal exam. That's how doctors try to take a feel of the prostate.
Is it painful?
No, it's usually not
I mean the
painful.
exam.
Oh, depends who's doing it.
Yeah. That's a good advertisement. You don't cause pain, right?
No, of course not.
So this is, you guys want a prostate exam? You got it. Okay, so I want to get to another one of Dr. Lombardo's demos, but I want to hear another question.
Well, the next one was we were wondering what causes prostate cancer.
Went into the park again.
Exactly.
All right, let's see. What causes prostate cancer?
What causes prostate cancer?
What causes prostate? I would like to say diet and poor exercise and treatment of the body, but I don't think I could be totally accurate with that answer.
They're not sure.
Genetics. I don't know.
What causes prostate cancer?
I'm not sure.
All right, what, you have like a little panel? Seems like it's the same. I recognize some of these guys now. Okay.
I asked a few people some different questions.
That's good though. These are good. These guys are all right. What's the answer to that question?
I think that's a great question, and I think whoever figures out the answer to that is going to be a billionaire. Certainly, there is some genetic predisposition. People who have a first-degree relative, a brother or a father with prostate cancer, are at higher risk for developing prostate cancer. We see a higher prevalence of prostate cancer in African American men. And I think, it's very interesting that one of the people, commented on diet and exercise, because I think that, the studies that actually have looked at diet and the relationship between diet and prostate cancer have been equivocal. But there is some evidence that, maintaining a good, healthy diet, having antioxidants, not maintaining a high degree of acidity in your body, that can be protective against any type of cancer, just your overall general health.
Thank you. I'm learning a lot here too. Dr. Lombardo, pretty good answers, huh?
Excellent.
Set us up for the next one because we're going to take a short break, but I like to give a little tease. What are we going to see?
So we're going to start with snoring. That's 40% of people snore.
40.
40%. And that's on a spectrum of severity all the way to apnea. So we'll talk a little bit about snoring and the treatment.
Let me take a little in-house poll here. Kirsten, I know you recently married. Is your husband a snorer?
I'm going to say no comment.
No comment. Okay.
So that's a yes.
I'll comment. My husband snores.
So I got 100% here, possibly.
It's easy, right? And I snore as well, so that's 150%.
Wow. So And what are you going to? You're going to show us something that can make you stop snoring?
Well, certainly things that can help reduce the snoring and
mean,
sometimes treat it.
How can you leave at this point? I mean, take a quick break, but don't go too far, because in about 1 minute we're going to hear what can make your husband stop snoring. And welcome back to Ask the Doctor, where our topics are urology, internal medicine, sleep medicine, where we have Dr. Angelique Kumar and Dr. Gerard Lombardo. Now, we were filling in before that Dr. Lombardo was going to give us a little tip on what to do about husbands who snore. Barry?
Okay, well, if I may, spouses who snore, because women snore as well. We have to be fair. So snoring, first of all, occurs in 40% of our population, so it's a common thing, as many will talk about the next day at the coffee machine. But the noise is actually caused by fluttering of the tissue in the back of the throat. And that's usually the palate flopping up and down against the back of the tongue. So it's the back of the throat tissue that's vibrating and causing the snoring noise. So what we can do is always advise some things to reduce the amount of snoring, such as drinking a lot of alcohol prior to bed will definitely make the snoring worse. Sleeping on one's back will make the snoring worse. So you want to try and have a side position. Any sedating medication certainly will make it more severe. Sleep deprivation, where you're so tired you fall into that deep sleep, again, especially on the back, will make snoring more severe. So we're going to show a few of the treatments then for those who come in and have simple snoring. And again, we'll talk a bit about more severe apnea where the same tissue blocks the tube. But for simple snoring with tissue that's vibrating, we have a few things that we can recommend.
So what do we
I'll
have
ask
here?
Dr. Kumar to help me if you'd pass that so I'm not reaching. Thank you so much. I'm the surgical assistant now. So this is a body position pillow that actually fits around the back. So this, if you can envision it in the back, and the straps come around in the front and hold it in place. And what that does is when you roll onto your back in sleep, it's uncomfortable enough that you roll onto one of the other shoulders. And simply by reducing the amount of time you spend on your back, you'll definitely reduce the fluttering noise because it's very positional related. So as the jaw falls back, the tissues flutter and block, and it's very loud. And for those, again, sleeping next to a snoring person, you'll note that the snoring is always less, or usually less severe.
Does it
when
come in
they're on
other
their side.
colors? Or you guys,
Don't know about that.
okay.
And this is about 60, 70 bucks on the internet. Thank you, Dr. Kumar. And if you want to use a cheaper or less expensive version of that, you go to your 99-cent store and you buy 3 tennis balls and put them inside that sock that you don't know what to do with, you know, the one that's lost. The mate of it is lost anyway. And you take some safety pins and position it on a T-shirt exactly that height that is here, but on the back. And just the 3 tennis balls are enough to keep you moving side to side and reduce the snoring. And that's called
You're getting some
positional
good
therapy.
tip there. Yes, good tip.
Easy. And $1.98, but
What
you
about
add
the wife
safety
giving you
pin.
like a jab?
The bed partner, spouse jabbing you is a cause of sore ribs more than anything else. It doesn't help.
So I'm gonna hold the next one.
Okay.
And I'm gonna go because they're getting cold in the park here. Kirsten, who's next?
Well, what's great is we have a couple of questions on sleep for you, Dr. Lombardo. So let's check out the videos. All right, so this is John at Prospect Park. And here's your first quiz question, John. How do you know if you're not getting enough sleep?
How do I know? I'm up pacing the floor.
You're passed out on the floor?
I'm walking around the floor.
Okay.
I feel like it would be, there's a lot of ways of knowing that, but
Give us an example.
generally I'm tired and I have a lot of mental fatigue, and I mean, they also say based on biorhythms and that kind of thing that you need 8 hours of sleep and that you need certain types of sleep, and that there's certain times of night that you get certain times of sleep that the body really needs.
Me personally,
Yes.
I'm fatigued. Fatigue in the morning, definitely fatigue.
Good questions. Good people
Excellent.
out there.
Yeah. Very
What
good
do you
answers.
What do you think?
Well, Lindsay and Todd both sort of hit it right on the head by saying that the quality of sleep, so the type of sleep you're getting, and certainly the quantity, but the quality of the sleep impact on your daytime performance. And we call that quality of life. And quality of life now is a big thing in all walks of medicine, where we try and make sure that you're living life the best you can, and we're talking about waking life. But the flip side of that coin is the sleep. So healthy sleep is very well defined, both in terms of how you are sleeping, or the quality and the quantity.
Thank you. Kirsten, I
All
want
right,
to...
another sleep question coming up. Let's check
Okay.
it out. And is it true that missing 3 nights of sleep in a week leaves you with the same judgment as someone that's alcohol impaired?
I would believe so.
Thank you.
You know, if that's true, I'm a little bit nervous over here. Is that true?
It is true, unfortunately. And I say unfortunately because there are highway accidents that account for countless deaths related to sleep deprivation. So the study that was done compared lost sleep to alcohol consumption and one's ability to operate a motor vehicle. That study specifically showed that losing sleep, being sleep deprived, would bring a person to the illegal limits in terms of alcohol level in the body, and also affect their judgment when it came to driving, stepping on the brake in time. And unfortunately, sleep deprivation does account for many, many deaths on the highway.
Scary stuff. I imagine with new baby and stuff, there are times when you go out not having slept enough for 3 nights.
Well, usually what I do is if the baby wakes up one night, then my husband will get up the next night. So we always make sure that we get enough sleep. I mean, I agree with Dr. Lombardo, you know, sleep is just extremely important, and you can't function properly without it.
But it seemed like in college and stuff, I don't know, Kirsten, like when you could somehow, your body could do more. You know, you could force yourself to stay up and you could pass the test the next day and then go to sleep. Did you ever have that?
That's very true. I remember a couple of all-nighters, but
Yeah.
the next day wasn't very pleasant.
Jerry, so you would not suggest an all-nighter for anybody out there taking a test?
Well, certainly not, but having been guilty of that myself, college and certainly our teens tend to have a social life that brings them to studying and staying up, and it's always Monday morning syndrome where they can't stay up.
So now, thank you. Kirsten, where'd you make it into the next question? Remember which borough?
Yeah, actually, we're back in Queens, and we're back talking about prostate cancer, and
Oh.
I'm asking them some questions. How common is prostate cancer?
1 in every 5 men?
I think it's common in men over 50.
Oh, well, to the best of my knowledge, it's very common, especially with older adults in this country, 40 and over. You know, I myself had to have a prostate exam, and I'm reaching 40, you know. But I think it is very common, according to what I've heard.
It depends on your age of men. Usually it's about 35% of men will have high BPA, which doesn't necessarily mean you have prostate cancer, but chances are that since it's very slow-growing cancer, there is a possibility that you might get it, but you probably pass away before it actually affects you.
Interesting. A lot of thoughts on prostate cancer. What do you think? Try and bring it together.
Sure. Prostate cancer is definitely very common. It affects about 1 in 6 men. So it's one of the most common cancers around. And as you get older, the risk that you will develop prostate cancer, or that a man will, increases. So you do see it more, you know, in more men, you know, over the age of 60 or 70 than you do in younger men of the age 30 or 40. And one person made an interesting comment, you know, that you may be more likely to, you know, have something else affect you in your lifetime rather than prostate cancer. A lot of men can be living with prostate cancer and it never affects them. And that's absolutely true, and that's, you know, one of the controversies right now about prostate cancer screening.
Interesting, because one guy could live with having cancer and he knows it's not going to spread, but another guy is like a worrywart, is saying, I don't feel comfortable having this cancer growing, even if it's growing so slowly. I want to have it out.
Right, exactly. There's a lot of psychological anxiety associated with the diagnosis of prostate cancer. And the problem is that it's impossible, or it's very difficult to predict whether, you know, a cancer is going to affect you, or if it's going to be slow growing and not affect you at all. But certainly, you know, it's a very controversial topic right now, and it's something that warrants a lot of discussion between patients and their urologist.
It's good stuff, because I know it's on the mind of a lot of men now, and we're all confused with the PSAs and stuff like that. Who knows? But anyway, why don't you show us the third way, how to stop snoring?
So I mentioned the back of the tongue flopping back and causing some of that rattling noise. And there's a device called an oral appliance, and it's similar to what a sports...
I think my grandmother had that.
Okay, maybe grandma snored.
I think those are her teeth.
Yeah. Sorry.
Yeah, it's like a mouth guard.
Yeah, and it has a hinge of some type. So this one has the hinge in the front. The idea is that as you're on your back and the lower jaw falls, I'm going to make the noise, sorry, but demonstrating. It drags the tongue back and flutters against the back of the throat. So the oral appliance is built so that it moves the jaw forward on the bottom, and even if you're on your back, the jaw cannot fall back and drag the tongue against the pharynx and flutter. So this is a very effective treatment for snoring.
How much does that one cost?
Yeah, thank you, Dr. Kumar. Very important is not NOT. Don't go into a local pharmacy and pluck something off a shelf. This has to be built by a professional who understands teeth shifting, TMJ. You'll get into a lot of trouble unless it's built properly. They can run $500 to $1,500.
Is it custom made for your mouth?
It's custom made, and certainly the insurance carriers are all covering this right now. Very important, especially when there's some apnea, and we'll talk about that.
I think if you're on your honeymoon and you have the snoring, I would probably let it keep snoring. Because this stuff, I don't know, we can talk about that later in the break. But Kirsten, what do you got in the next video?
The next video, we have another question about prostate cancer, symptoms. What are the symptoms?
I don't know.
I don't think there's any symptoms at all. Maybe urination.
Oh, I don't know the symptoms. Wow.
What are the symptoms?
Problem urination, incontinence. Basically, that's about it.
Oh, that's symptoms of prostate cancer, urination. Yes.
Yeah, that's an interesting question. When it's very advanced, it may cause some symptoms of, blocking urination. If it's spread outside of the prostate, it can cause bone pain. Usually, prostate symptoms are caused by benign enlargement of the prostate, and that can certainly cause frequency, urgency, the need to run to the bathroom. So, prostate cancer itself doesn't really cause symptoms.
Okay, I think I'm getting some symptoms. So what we're going to do is take a little break, and when we come back, we're going to be answering some more questions. I want Dr. Lombardo to set us up so they don't leave us at the commercial. What's going to be presented next?
Well, we're going to go down the line of treatment severity towards surgery and a CPAP machine to correct.
CPAP is what I want to see.
Yes.
Yeah. I want to see how people can go to sleep with this on, but you'll show us that, right?
It works.
Okay, excellent. So what we're going to do is we're going to take a short break. You can take a short break, and we'll be back in a little while, and we'll be talking about the CPAP machine. And welcome back to Ask the Doctor, where our topics are urology, internal medicine, and sleep medicine. Now, just before the break, we asked Dr. Lombardo to tell us about the CPAP machine.
Sure.
It's here.
Absolutely. So again, we're thinking of ways to open up the back of that airway. So we can send a column of air that gently moves the tissue out of the way so that each breath is clear. There's no snoring, no noise, and most importantly, the oxygen gets to your body to help your organs and to help you restore, as you should, during sleep. So the machine is called a CPAP machine, continuous positive airway pressure. First thing I want to do is show you how quiet, amazing engineering.
Wow.
Now that pump is on.
I can't hear it.
So this is sending air, and when it's attached to a mask, there is no sound. So that's always good news for the bed partner. The spouse will not hear a loud noise from the machine as was the case 10 years ago.
You put this in between you and your spouse, or what do you, with the actual machine? What do you do
It
with
sits
that?
on the night table.
Okay.
I do get a question sometimes. I see couples with apnea. They want to know if they can connect this to a Y piece and have one mask going to. Can't do it, no.
Can I get a longer model? It's all right, it's okay.
Okay, so, so the mask then. So the hose attaches to some type of mask. One of the more popular masks now is referred to as a nasal pillow. So it's small, and it fits in the nose, and this attaches to this end. And you're quite free to turn side to side, silent motor, no snoring, most importantly, no apnea, and no ill effects on your body from choking all night. The mask of old tended to look a bit more bulky, and certainly we do need a full face mask on occasion that covers nose and mouth. So it goes over. Fighter pilot, made pretty famous by the Sopranos episode where Junior was wearing one of these. But certainly the full face mask, and this you can imagine what it feels like to sleep with a full
Halloween,
face. Rarely we do.
What is this?
Right.
Who's that guy in Halloween?
Silence of the
somebody?
Lambs.
Silence of the Lambs?
Right.
Jason.
So we're trying to make them more comfortable, and certainly the engineering amazing. To help you sleep, you need something comfortable. And we do fit the person, custom fit during a sleep study. And we measure the pressure exactly, and that's the prescription that they get to treat
If
that
this were
apnea.
retail, how much would it sell for?
Retail?
Yeah. Well, we give a discount.
$800 to $1,200. So
Wow.
that's, and it's covered by insurance because the healthcare cost to someone not treated is double that of someone treated.
Dr. Lombardo, are patients very compliant with using the sleep equipment once they start using it? Is it something they can adhere to, that they can stick to?
It's an excellent question. I think if you do proper follow-up and bring them back after 30 days, there's a little memory stick out of the back, and you can tell exactly how many hours the person's on it. So if you look at the memory stick and you talk with them, ask them what the issues are, you can usually correct half of them, such as mask fit. I don't like the mask. And as long as you bring them back, the compliance goes way up.
This is great, because we've heard about it, now you've seen it, and it seems reasonable. I think, you know, when you prejudge it, you think, I can't use that, it's not possible. It doesn't seem that bad.
I had a patient last week, and Dr. Lombardo, this changed my life. Again, it's a quality of life.
Excellent, excellent. Thank you very much. And Kirsten, what do we got next?
Well, the next question is something I am actually very curious about too. It's what foods are you supposed to avoid before sleeping? So let's check out the videos. Finally, what are foods to avoid before going to sleep?
All foods.
All foods.
I eat everything before going to bed.
Nothing after 6 p.m.
Perfect. Thank you, John.
More than welcome.
Sugar, coffee, alcohol, any processed foods, and someone said bacon recently, and even like just fruit, anything that can that sort of will wake you up before going to sleep.
Simple carbs, high sugar foods. You don't want any of those.
Any kind of food, I guess. If you're going to sleep, you don't need food.
So don't eat food before going to bed. Thanks, Daniel.
Oh, that's some good answers. Anything stand out? Is the right one?
Well, Daniel's explanation was excellent, the last one. You should not eat a large meal before bed. And it's amazing how many times, I guess it's a sign of how busy people are. They're at their job and they dash home, it's late, and they grab the meal. Don't fill up your stomach prior to bed. The other answers were good as well. You should not, anything caffeinated, so think about things that stimulate. But, you know, someone will say, yeah, I drink a liter of Pepsi all day, and most of that is after dinner, and there could easily be a sleep problem with that.
Interesting. Well, let's do a few rapid-fire video questions. Let's go right next to the video.
All right, let's do it. This is about prostate cancer. All right, so my first question is, how old are you?
How old am I? Ancient. 85.
85, perfect. So do you think that you, an 85-year-old man, should go for prostate screenings at this time?
I had them done already.
When's the last time you had one?
I had seed implants about 7 years ago.
He's enjoying himself in the park. Kirsten brought him down. I don't know what happened, but no. It's great to see you on the show. Yeah. What is that?
So,
what do you got?
for the men with the prostate issue. So the one thing I'll comment on is polyuria or nocturia, so frequent passing of urine or passing of urine during sleep, where, again, that's not an activity that is conducive. So Dr. Kumar, I'm sure, would tell us about nocturia.
Yeah, absolutely. Getting up at night to urinate is a frequent complaint, and it happens not only in men as they age when they develop enlarged prostate symptoms, but also as people get older, their kidneys actually make more urine. And so getting up at night causing a disturbance in the sleep is a big problem that people have, and it's not the urinary frequency, but it's the disturbance in the sleep. So we tell people various things. One is to limit fluid intake after 6 o'clock and really try to urinate out whatever is in their system before they actually put their head down to go to sleep. Same with elevating the legs for a couple of hours before bedtime, so all that fluid that's sort of out in the tissues can come back into the circulation, and you can urinate that out before you go to sleep. So a lot of behavioral techniques to try to limit the amount of times that you get up at night to go to sleep, and you don't have that disturbance in your sleep. If you get up 1 or 2 times, there's not that much we can do about that. A lot of people get up 1 or 2 times, but when you're getting up more than that, then that's a problem.
The next question is on the tips of many tongues.
Indeed, and it's talking about the normal amount of sleep for adults. Yeah. So let's see. What is a normal amount of sleep that adults should have?
6 hours.
An adult of my age should have at least 8 to 10 hours a night sleep.
I think 7 to 8 hours.
They say anything 7 to 10 hours.
What is a normal amount of sleep that adults should have?
What do you call an adult? I mean, 10 hours at least.
10 hours. Okay.
Okay, 10 hours. Is that too much?
Yeah, it's a hot topic. Certainly, there's a range. So the average amount of sleep necessary for good health is 7 to 8 hours. Now, we do have something called a short sleeper and a long sleeper. I mentioned 80 sleep disorders. So these are actual diagnoses: short sleeper, long sleeper. And it's found that 5 hours for some fortunate individuals is enough for them to have a good quality of life. We spoke about that. And there are presidents of countries and other leaders, and they require only that core 5 hours, and they're fine. Others need more 9, 10 hours, but the average is 7 to 8 hours.
7 to 8 hours. These are great questions. I'm going to pause for a quick email question, and then I'm going to come right back to these videos.
We do. We have an email. It's from Rohidas in Mumbai,
Whoa.
India. Isn't that cool? Okay, his question is, Sir, I had an accident in November of 2011. The flesh between my right thumb and index finger got pierced. I got it stitched in the hospital, but even after the removal of the stitch, it still hurts today. Please send any solution.
Interesting. I like what he says, sir. It's very nice, very genteel.
Very polite.
So I have a sleep specialist and a prostate specialist, a urologist. What about between the fingers? It's got a little, sound like he had a little scar formation there?
He said it was between his thumb and his index finger?
Yes.
I'm guessing right here.
Yeah. Probably he's having a hard time healing that area, especially if it's on the right hand, if you're using the right hand a lot. So probably you want to give it some rest and allow it to heal properly. And if it's formed a scar, which is painful, you could also try scar massage with some like vitamin E cream into the actual scar. You could also see like a plastic surgeon or someone who may be able to inject a corticosteroid into the scar. That often helps to soften scars.
Very interesting. Did he give a name?
Rohidas.
Oh, okay. I thought that was the town. Okay.
That's his name.
Very
He's from
nice.
Mumbai.
Mumbai.
Mumbai is the town.
Mumbai, they're changing all the names. It used to be Bombay, right? It's like
now it's
changing New
Mumbai.
York to New Jersey or something. Okay. What do we got here? We got a video now?
Yeah, we got another
Okay.
video asking some questions. Let's check it out. What is a PSA?
Public service announcement?
That's something to do with prostate.
Public service announcement. Other than that, I don't know what PSA may be.
PSA is prostate is basically the test to see if the hormone that is released by the prostate is high, and that's an indication of prostate cancer or prostate growing.
Hey, Doc, what is a PSA?
He took over the reins here. So, Dr. Kumar, is it worth knowing what PSA means?
Yes, absolutely. A PSA is a blood test that is taken. It's used to measure a chemical which is secreted by the prostate gland. It stands for prostate-specific antigen. The PSA level can be elevated in a variety of conditions, one of which is prostate cancer. It can also be elevated when there's inflammation in the prostate due to infection or urinary retention, and it can be elevated when there's just benign enlargement of the prostate from benign prostatic hyperplasia. So it can be elevated for a variety of reasons, but we do usually use it to see whether it's elevated in the setting of prostate cancer.
I like that none of our video fans use the word prostrate, right? They always say, oh, my prostrate is this and that. Isn't that a pretty smart audience?
Yeah, it's a great audience.
I like that. Okay. Let's go right to the next one because we have so many.
Exactly. We actually have Anya, and she's asking a question to the doctors.
Okay.
Hi, Dr. Lombardo. I'm a restaurant manager, and therefore I'm a shift worker. And I was wondering how and what is the amount of sleep I should get to get enough.
What do you think, Jerry?
Okay, so that's Anya, right? That's
Anya.
Shift workers make up 25% of our workforce. So this is a very important question. And unfortunately, that requires shifting around the clock to make sure all disciplines are covered. And we see our ambulance, emergency room workers, restaurant, etc. And it is very difficult to maintain a schedule sometimes that's conducive to good health and good sleep. So there are a few key things that we try and focus on. And Anya mentioned, again, that 7 to 8 hour average is very important. So the amount, and then the quality. Remember, it's not only the hours, but is it good sleep? So the thing that makes my ears go up is I'm seeing a patient with shift worker sleep disorder, and that's the name of it, when there's a problem, is I ask them, what is the shift schedule? So there's a variable shift where they can start midnight to 8, and then the week after that, they shift again, and then again, and you can see a pattern of the brain not being able to regulate the circadian balance for normal sleep. And that's the challenge. So you want to try and be regular in terms of your shift work. Try and keep a strict 12 to 8, for example. And then you have strategies. If you have to split your sleep, it's okay to do 4 hours and 4 hours if you have to, as long as you get that 7 to 8 general amount of sleep. So there are strategies such as that. Things like asking friends not to call. You come home, it's 8 in the morning, you just finished your shift. There are things to do. Life pressures and stresses. Try and get someone else to help with taking the kids to school or doing the shopping so you can get your protected 8 hours of sleep, even if it's shifted into 2 parts.
We're going to turn it into overdrive here because we've got only about 5 minutes left. Let's go right through these.
Let's see another video.
Dr. Lombardo, is it possible to catch up on lost sleep?
So, do you think it's possible to catch up on lost sleep?
To an extent.
To catch up, I sleep all the time, so I couldn't answer that question.
Actually, yes. If you're actually in a deficit, your body's gonna automatically have to catch up. So you're gonna be fatigued throughout the day. So you do catch up on sleep. You have to. Your body will shut down.
What are we at? Lost sleep?
Actually, unfortunately, the answer is no. So if you go and for some reason you're up for over a day and a half, your body will store that as a debt. So there's money debt and there's sleep debt. And certainly you cannot make up the damaging effects of lost sleep.
I'm trying to get to the last question because it has to do with sexual function and prostate. So the audience, with big sweeps week this week.
So, well then, in that case, that's the end of the answer.
Let's go right, so right to the next question.
Can prostate cancer be prevented?
Hopefully.
Possibly.
Yes. Like anything, I do think, without knowing how it could be prevented, I think a healthy diet, exercise, lifestyle, a good mental and stress-free would probably remedy all of that, I think.
Can prostate cancer be prevented?
No.
Who's got the right answer? Can it be prevented?
I think we don't really know of any great ways of preventing prostate cancer. There's some data that suggests that medications like Proscar and dutasteride may prevent low-grade prostate cancers. But prostate cancer, absolutely healthy diet, exercise, maintaining overall general good health is always a good idea. But as far as preventing prostate cancer, I think no one really knows.
If you see it in the store and they're selling it, it's not going to work. What do you got?
Next question is from Gary, and it's about his PSA.
I just recently went to my doctor, and he told me my PSA was 3.0 last year, and it went to 6.0. So I'd like to know what the procedure is. What should I do? That's it.
Not so much that he had a 6, but that it went from 3 to 6?
Yeah, absolutely. I think, this is a common situation where we see a dramatic rise like that in a PSA level. The first thing that I would do is recheck it, make sure that that 6 is accurate. You also want to know if you're having any urinary symptoms or retention of urine or anything's going on as far as possible inflammation in the prostate at that time. We would check a rectal exam and make sure we don't feel anything new in the prostate, any nodules or anything like that. And if we suspected that maybe it was due to inflammation, then we could put you on antibiotics and a medication to relax the prostate for 4 to 6 weeks, and then we could recheck it again. If there's nothing else going on and we feel something on your rectal exam and we recheck it and it truly is 6, then we might proceed right at that point to say, let's do a prostate biopsy.
Thank you. Dr. Lombardo, we have one coming up for you now.
Yep, this question is from Kim.
Dr. Lombardo, is there any type of psychotherapy that will help me fall asleep?
Interesting. Is there such a thing?
Actually, the proper treatment of any insomnia involves what's called cognitive behavioral therapy. So the short answer for Kim is absolutely. If you're having trouble sleeping, you should speak with your doctor about getting some help from a form of psychotherapy called cognitive behavioral therapy, which incorporates all of the things that should help you to get a good night's sleep.
Interesting. So no quick fixes here. Do we have time for one more?
I think we do, and this is Helen talking about Ambien.
I was not a good sleeper, so my doctor put me on Ambien, 10 milligrams.
Do you want to ask the doctor if Ambien is a good thing to be on?
Yeah, but the thing is, I found out for me it was not good because I would get up in the morning, at night, and walk around, go to the refrigerator, whatever, and they would tell me the next day, and I didn't know nothing about it.
So, doctor, what are your thoughts on Ambien?
Ambien, been in the news a lot.
Yeah, sure. Certainly, it's an important hypnotic. That's the category of drug. Relatively safe. Again, as in the last question, any medication should always be combined with cognitive behavioral therapy. Most sleep disorder specialists, myself included, believe that the answer for insomnia is not in a pill. We don't want to just give a pill and say, go to sleep, take this pill. Now, speaking again to Ambien, it does have some potential side effects, and it's important to remember that any sleeping pill works best when you follow good sleep hygiene and you take it in sync with your circadian balance for sleep. So we all have a tendency to have sleepiness in a certain phase of our 24 hours. So the Ambien works best, again, when it's combined with proper hygiene, proper routine for sleep. You want to relax and wind down. You don't want to be balancing a checkbook and all excited and watching a thrilling movie and expect that a pill is going to shut everything off and put you to sleep. Always combine it with proper hygiene and other measures.
Excellent, excellent. Kirsten, drum roll for the last question.
Yes, the last question is from Lawrence, so let's check him out.
Hello, Dr. Kumar. My name is Lawrence Logan, and I would like to know, can prostate cancer or any deformities with the prostate affect sexual performance in men? Please let me know, and have a good day. Thank you.
What do you think about that in 30 seconds?
Prostate cancer and even benign prostatic hyperplasia, it shouldn't really actually affect your erectile function itself. There is a link between men who have symptoms of benign prostatic hyperplasia and men who have erectile dysfunction, meaning that a man who has symptoms of an enlarged prostate, not prostate cancer, but just benign enlargement, is more likely to have symptoms of erectile dysfunction as well. Whether there's a common pathway that causes both of those conditions, we're not entirely sure. But we are starting to look at some of the medications that we use for erectile dysfunction to treat benign prostatic hyperplasia as well.
Thank you so much, the two of you. Really, I don't know where this knife flew to. That's it for this episode of Ask the Doctor. Before I thank Kirsten, I just want to say the boy's name is Liam, and the girl's name is Emma, and it's the Basilica of St. James that was built in 1822. So those at home, that's what we have. Kirsten, thanks as always. Dr. Kumar and Dr. Lombardo, really two of my favorite guests. I enjoyed the show immensely. Thank you for coming in. So always remember to get second and third opinions. Be proactive about your health. You speak to your doctors. Don't be afraid to express your concerns. And visit our website, because you're going to get information on our website. There you can see the tablet column. You can see past shows. You can see questions, forums that other people have to discuss. And I want to thank you, Kirsten, for going out in the fields and getting those great questions. We've got to do this again real soon.
It was a lot of fun.
This was great. So you got more coming in. Email more questions to us. We're going to answer them. And as I say always, have a great week. Be well, and I'll see you guys in the tablet. Take care.